We all visit the hospital from time to time. Believe me, I've been there a few times myself. I have 6 kids, 7 if you include my husband. Hi, I'm Kelly Plotner, and I'm going to share with you a revolutionary new way of caring for the health of your family. Families are really struggling with health care right now. You have your die-hard medical people looking only to the MDs. You have another group looking to alternative health care like chiropractic. Then you have your group that is open to both the medical and alternative fields as long as it works. That's me, and I believe that's most Americans. The struggle comes when you feel like you have to choose between one or the other.
I never thought anybody could help me. I've been on every drug there was imaginable.
After doctors said that I would not, without the surgery, be able to use my arm again, I can lift my arm.
This is a new way of being treated. Offer me options for treatment for my family.
There should be more of these.
The best of conventional medicine and alternative health care. Welcome to the multidiscipline revolution. Healthcare will never be the same.
With so many specialists now, who can I see that won't be biased towards their specialty? Well, I found it, but it's not a person, it's a team. There is a place you can go where a medical doctor or family practitioner, chiropractor, physical therapist, and others are actually in the same office and collaborate together for your benefit. It's called multidiscipline offices, meaning there are many disciplines under one roof.
What multidisciplinary team approach truly means is that we have physicians of all types working together as a close-knit group. So we have what we call accumulation of knowledge, not just one specialty, what we call regular looking at them in a blinder type of sense, all right, tunnel vision. This approach brings the uniqueness of our office together, and the effectiveness of our care becomes very, very noticeable in a short period of time. The patients realize that having a family practitioner look at it at the way that their general practitioner would, along with a chiropractor looking at it at a musculoskeletal functional component, is very, very important, because it's not the magic shot, it's not the magic surgery or the exercise or the chiropractic adjustment. It's all of those together that really make it more efficient and more beneficial for the patient.
By coming to a practice like this, a facility like this, the patient is bound to get quicker care, because the actual physical difficulties of calling and making an appointment in a strange office, the time involved will delay the treatment. Now, this treatment isn't life or death, we understand that, but there is no doubt that it is convenient and much less cumbersome for a patient to walk down the hallway and see another physician when that is possible and when it's necessary, than having to make an appointment, drive across town, etc. So from this point of view, there's no doubt this is better for patient care and, I think, patient results.
If you think about it, it just makes sense. Let me play it out for you. Say my husband started getting pain in his neck. I could take him to a chiropractor, a medical doctor, licensed massage therapist, physical therapist, whatever. Well, each one is likely to be somewhat biased on what is wrong. But if I take him to a multidiscipline office, he'll be looked at as a whole person from many different angles of health. By the time he's been seen by the specialist, they're going to know more about him than he knows about himself. Then we'll be given options based on many different approaches to health, so we will be an active part of the process.
There's a problem, and it's not just one thing. With a multidisciplinary, we're pinpointing what the problem is, but we're not just fixing that problem, we're fixing everything. The chiropractors fix the actual framework. The massage therapists fix any deep problems. Physical therapy does the strengthening, the stretching, building the proper posture. And the doctor provides the medications, any kind of injections, just the physical work that the patient needs. So we're not just doing adjustments, or we're not just strengthening, we're hitting everything. So the patient's not just getting one type of care, they're getting every type of care possible.
I believe that the multidisciplinary healthcare center makes a lot of sense, especially for American medicine. Everything's under one roof. It's far more convenient for the patients, keeping them happy. One patient may have severe cervical or lumbosacral problems with bulging discs or herniated discs. But they also happen to have gastroesophageal reflux disease. And there's certain drugs that I would hesitate to prescribe for them. So all these disciplines work together. And I let the chiropractor know that there are certain drugs that can't be used on certain patients for those reasons. You have to keep your eyes and ears open and look at the patient as a whole.
Are you getting the picture? We didn't have to run all around town from specialist to specialist and will be a vital part of the health team. This has never happened in medical history before, where the powers of the health industry are cooperating for your family's benefit, not the other way around. The multidiscipline office just makes sense.
It took so much time. You had one doctor, then if they treated you and it didn't work, then they called in this one. It just took so long to get everyone in working together, where these doctors confer on you. Every time you come in for an office call, for treatment, it's right there. Anything that you need is right there.
I was so frustrated, I opened up the yellow pages and started going through the yellow pages looking for something, because I knew I was not crazy, looking for something to deal with the pain. And I just come upon this place. It was 5 minutes from my house. I come in here and I was amazed. There should be more of these. It's so wonderful, so convenient to have a place that you can go in and have everything done. Your treatments, the doctor, your prescriptions, your alignments, any kind of physical therapy you need.
I'm very satisfied with everything they've done here. It's great to be, I didn't even think something like this existed, to where you could go through and do everything in one office. And I've seen all three of their doctors here, so it's not, these people get to talk to each other. And so if nothing gets missed, it's really hard for anything to be missed, because they're all right here under one roof and they all get to talk together.
The multidiscipline revolution. For people who expect better care and better results, it just makes sense.
Let's go to the hospital or typical doctor's office. Get ready to wait. It's usually 3 weeks before I can even see someone. And then I sit in the waiting room, hoping someone behind the glass calls my name. I'm feeling impersonal and cold. I have a friend who was given a number, like in a deli, in her gynecologist's office. This really happened. So after being called, I'm waiting for the doctor to arrive. Question, do you think this doctor has time to really listen to me? Volume is the name of the game. This doctor is pressed for time, and for some reason, I feel like it's my fault. But it's not my fault, and it's not your fault. It's the system's fault. The system is more about policies than health itself. Compare that to the multidiscipline office.
In the multidisciplinary team approach, you are not a number. You're a part of our family. We get to know you as an individual. We know every family member. In fact, we even know your grandparents' history, because that's important. What we like to do is to have the patient really understand that this is kind of like the old country doctor atmosphere, right? Knowing everybody, being able to ask questions, taking time and our genuine concern of you as an individual.
The people who do come here are not only getting the treatment, but they're also gaining a friend here, someone who cares what their lifestyle's like, what they want to do. They want to get back to work. They want to get back to their home, playing with their kids, going out to the park. And I can see that when the patients first come here, they're very sore, they're in pain. By a week, 2 weeks, you can see that they're smiling when they're coming in here. They're enjoying being here, because they leave knowing that they're getting the best care. They leave knowing that a couple months down the road, they're going to be as close to 100% as possible, because everyone in here cares about their well-being.
Before I came here, I didn't think there was a doctor's office that would talk to you more than 2 minutes at a time. Most of the doctors I've ever been to, they come in, they ask you what's wrong with you, and they poke around on you a little bit, and they're gone. No questions, no, they don't ask you. Here, it's how are you feeling today? This is the first question they asked you when you come through the door. How are you feeling today? I've never had a doctor ask me that before. It's like, what's wrong with you? But here, they care about how you feel, and they want to correct if you're feeling bad.
They're for real about it. If I need something, a pillow or something like that for my feet, yes, I want a pillow, they give it to me. They make you feel comfortable, relaxed and comfortable, because you get the treatment, but you get also relaxation.
Now this is just the tip of the iceberg. Stay with me. You will look at healthcare in a whole new way, and will stop feeling like a pawn of the healthcare industry. And yes, there is a multidiscipline office near you.
How would you like to be treated as a whole person? How would you like options in conventional and alternative fields of health? How would you like to be listened to and have your questions answered? Experience what it's like to have hope, freedom, and results in your family's health. At North Dallas Rehab and Wellness, professionals from medical physician, chiropractic physician, to physical therapists work together for your benefit. This team also utilizes cutting-edge equipment to bring about a whole new level of care for your family. A typical first office visit usually costs $250, but through this special TB offer, you'll receive an examination and up to 2 x-rays for only $79. A $250 value for only $79. Most insurance is accepted, including workman's comp and personal injury. Join the multidiscipline revolution. Call North Dallas Rehab and Wellness at 972-248-3101. That's 972-248-3101. Welcome to the multidiscipline revolution. Healthcare will never be the same.
Another thing I want for my family is options besides surgery or drugs. People are getting tired of just taking more drugs. That's why drug companies are scrambling right now. Have you noticed they're advertising directly to us now? Have you seen the big magazine ads from the drug companies where half the ad is a disclaimer? Drugs definitely have their place. I just don't want that to be my only option.
I've seen the chiropractor help people who went, for example, with migraine headaches. I always wondered, why are migraine headaches all usually one-sided? He says they usually start in the neck, and sure enough, every headache that comes in here, I'll get their neck x-rayed. They may have a couple of vertebrae that are rotated out of their normal position. With 1 or 2 or 3 good adjustments, they can walk out here with no headache. It just amazed me. With all the pharmaceuticals that are out there for migraine headaches, it changed my whole concept of migraine headaches.
What we like to explain to our patient is prescriptions isn't the only means of treating chronic pain. Unfortunately, a lot of the patients that we see have fell into that mode. And what we try to do is bring them out of that mode and start to address their chronic pain in more of a functional manner. Things that you can change in your activities, way that you do your chores around the house to improve and decrease the aggravation of your chronic pain.
Starting with May 25th, I had a headache that I had for 4 days. I came in and they were gone. 5th day I could deal with it. I had no more pain. They're amazing. I don't know what else to tell you, but they're amazing. I never thought anybody could help me. I've been on every drug there was imaginable, codeine, Inderol, everything, and nothing helped till I came here. I don't even take headache medicine anymore.
Particularly my children, if I do not have to administer drugs to help them alleviate symptoms, then I have the option here not to do that. And that is what makes me happy, that I have a facility like this to come to.
Avoid unnecessary drugs and surgery at North Dallas Rehab and Wellness, 972-248-3101.
Americans today are very open to alternative medicine, especially if surgery can be avoided. But you feel like you can only do one or the other. That's why I love multidiscipline offices. You get the best of both worlds. It's smarter and more comprehensive.
I guess the way to say it is all kinds of ways to skin a cat. And most people don't want to have surgery. That is a last resort. I can speak as one. I would try any type of therapy that is reasonable instead of having an operation. Now, when the operation is inevitable, obviously we have to go that way. But there are a lot of conditions that either don't need surgery today, that can be treated, ameliorated, eased, delayed, or whatever, so that the patient does not have to be disabled, doesn't have to lose work, and also ultimately run the risk of having surgery with not very good result.
I had been to 7 different doctors, had 8 different tests at 3 different hospitals, and the only option that I was given for ever being able to use my arm and hand again and have feeling in them were a surgery to cut the muscles across my collarbone. Had a 60% chance of success, and a 6% mortality rate. After all those doctors, all those tests, that was the only option that I was given. I was driving 40 minutes to visit a doctor, 25 minutes to go to physical therapy. I said, there's got to be something better than this. Got out the phone book. I have been under treatment for 3 weeks. After doctors said that I would not, without the surgery, be able to use my arm again, I can lift my arm, I can move my fingers. I went back to work yesterday. It's only 2 hours a day, but that only lasts a week. Then I go for 4, then 6, then I'll be back to work. It's just absolutely amazing to me to have so many doctors tell me that my case was hopeless.
How would you like to be treated as a whole person? How would you like options in conventional and alternative fields of health? How would you like to be listened